So I'm going to come to you, Bev, and just talk a little bit about. We've talked a lot about the body maps, but do you see real value? And we did sort of touch on this a little bit in terms of how they can be tweaked for other conditions. And I know one of the conditions that's mentioned here is congenital myelocytic nevi. I'm not sure if I'm saying that correctly. CMN. Is that something that you've discussed? Have you got thoughts about that in terms of broader conditions?
Using the body map.
Yeah.
Yeah, I think yeah, absolutely. It goes across many conditions. It's got lots of uses
Mm.
for families and for professionals. So there's not really anything wrong with it. It's just how it's used and how it's distributed between services or how connected things are.
Do you
Uh,
think
uh,
that that gives more power to the sort of, and we talked about that bringing the technology and the concept together. Do you think it gives more power to the ability to use something like this as more of a system rather than a sort of a nice to have if other conditions are also really
Yeah,
advocating for it
absolutely.
as
If
well?
there is a cost associated with it for an NHS trust, they're probably going to say no at the moment. It's not a
Yeah.
priority. So, yeah, and especially for something that's rare. So, yeah, to attach it to other conditions would absolutely be a great idea for all of those conditions,
Yeah.
as long as it's useful in for each of them really individually. I wanted to say really that it would form, I think, Lily, I haven't sort of looked at what the transition care is yet because my daughter's uh sort of not even a teenager yet. Um, but I know that I've been an advocate for her in each appointment, and sometimes you can go in and say, "So, how can we help you today?" And
Yeah.
so I think having some sort of like passport, a health passport, I've brought up my daughter to think like that, to know what's going on in each appointment, so that when she becomes an adult, she will come in with a list of things she requires from that service on that day. Because again, doctors and nurses have got limited time, so we sort of prepare for each appointment to make the most out of it.
Yeah.
This is
And that's
responsible.
a shame, really. And I think, and the other thing I wanted to say, sorry, was um that while I'm grateful we don't need a complex service, we do have lots of different. I say we, it's her that has the condition and sort of deals with her symptoms that are quite significant. And it's only really CTT that fills that gap. And I'm so grateful for charities like them stepping in, um, because and we stumbled across them. To be honest, we didn't get referred to them by the paediatrician or anything. I can't quite remember. I remember how we came across them, probably googling something, but they have been the only thing really that has been as helpful for us outside of those medical appointments of living a life with NF1. And yeah, I'm grateful that it exists, but it's a shame that it has to be, charity driven or whatever, because it
Quite.
must be quite hard to run. Um,
And touching on what you said there about transition, I think, and one of the things that Lily can maybe talk about as well is that we talked about the responsibility of parents as well, imparting what we know to young people. Because of course we've been the advocate, we've been the voice, we know hold all the records, but at some point that has to be handed over to the young person in a concise way that they are empowered, so that they, when they first find themselves in a appointment and they're asked questions, they don't go, oh, I don't know, my mum would know that, my mum would, they have all that information. Do you want to talk a little bit, Lily, about what, there's some of the broader sort of transition conversations we had around that?
Yeah, so it was like finding somewhere to put all the main diagnoses, because they don't obviously need to know every single little detail in everything, and that would be too much for everyone to remember, especially for lots of people with NF, because quite a few of us can have memory problems. I know I definitely do. So it can all be very overwhelming to try and remember what to say, when to say it, how everything is. So in the transition leaflet that we're hopefully creating, it should hopefully have lots of different sections where all your main diagnoses can be put, and all the main treatments you've had for those diagnoses, which should be really helpful in helping hand over the responsibility from parents to the young person. And then if the young person, they can just take the important bits with them, or they could have a copy on their phone, And then if they need to remind themselves of questions and what that appointment's for, they can just look through their book, and then hopefully that should help with ideas or questions that they might need to ask.
Brilliant. Thank you, Lily. Will, I'm going to come to you for just a quick, to you and Vi for a quick question before we sort of try and wrap things up a little bit. Single most important policy or funding step required to future-proof NF1 care and ensure consistent national standards? What would be your single sort of wish there?
I'm trying to drill it down to one. It's a pressure, isn't it? So
Yeah,
I've thought about 4 things I want to say, but I'll pick one.
You can do 4, but quickly.
I can do more than that. I'll be very quick. So I think, one thing, I think the nice quality statements, I think people should look at those and really think hard about how you could implement those for NF1. I think the clinical nurse specialists for NF1, expanding those and potentially placing those individuals in community settings would also be a real help to support patients post-transition.
Amazing, thank you. And Vi, systemic changes that you believe are necessary to ensure mental health and well-being is supported consistently and integrated into NF1 care pathway.
Remind them consistently that their voice matters, and give them ways to communicate in the way that best suits them. It's too often a habit that we say, "Oh, can you write this down?" But you could do it in art form, in video form, in talking, in interpretive dance if you want to. And Lily could make a cake about how she feels about NF1. Anyway, just give them that they can communicate in any way that suits them best, so that they know that their voice is important. It's not only important if they do it this particular way.
Thank you. And we cannot end without reflecting on the impact of CTT. I mean, I think Bev and Lily have both also sort of mentioned this, but what's the one thing that you feel CTT has changed over the past 10 years? And I'm going to come to you first, Will.
Yeah, I mean, I think patient groups, obviously, often when you're given a diagnosis, it can be quite a lonely existence, and then groups like CTT, patient groups, you suddenly realise you're not alone. There's someone who's walking this walk ahead of you, and it's a vast wealth of help and support and information, and also reassurance that you're not in it. You're not alone in this as a family.
Yeah, thank you. And Bev, I know you've already said how much you'd have appreciated and how much support you've had. Vi, I'm going to come to you next. What do you think's the big sort of impact you've seen?
I've been involved with them for almost a year now. I've been involved with other charities that help people with my condition for a lot longer, and I think CTT are absolutely incredible. I love how they really do value the voices of the people living with the condition, and I love how not only are the young people consulted, but they're also considered in the decision making, and it's not just tokenism. And quite often, as disabled people, we can often feel that we're, perform, and then our voices aren't actually considered in the decision making. And CTT are exceptional at not doing that. They're exceptional at including people.
Oh, that's lovely. And I'm going to give the last word to you, Lily, in terms of impact and benefit that you've seen from the charity.
I think it's all the support that we've received from meeting with CTT, and especially useful for children and young people, being able to meet people their age who are just like them, and they can just make friends with people who just get it. And you can talk, 1 minute you could be talking about what you're doing at the weekend, and then the next you could go on to something medical and just have a laugh about that and instantly connect. And from like days out at theme parks, where you can just forget about all the medical worries that you normally have on a day-to-day basis, and just feel like your average kind of family without having to stress about scans and appointments constantly. And the camps are just incredible because you get the chance to just go away with your friends, which quite a few people with NF1 can struggle with and not get the chance to do with schools and that.
Oh, and it goes back to what Vie said at the very start about normalising and having, making
Yes.
life feel more normal. Thank you so much. I know that Will has been doing a great job of answering some of the questions that have been coming in, so thank you for that, Will. I want to wrap up because I want to be respectful of everyone that's watching's time, but those that we haven't got to, we will put to the panel and respond back. So just to say thank you so much to everyone that joined. It's great to have a great uptake of everyone coming in and participating and asking questions. We really appreciate it. Thank you, of course, to all of our speakers. It's been a great panel today, and we've got through a lot. But thank you to CTT for sponsoring the webinar as part of their 10th anniversary celebrations. The REV-inar will be available on demand later today, and then the resources will be uploaded onto our website in the coming month. Please feel free to reach out to us via the contacts that will come up on the screen at the end when we finish, if anyone has any follow-up questions. But for now, bye to everyone, and thank you all so much for taking part. Have a great rest of your day.